Hi everyone, it's Dr. Talley again here with Spero CBD. For those of you who didn't tune in to us last time, I'm the Chief Medical Advisor at Spero CBD. A little background about myself: I'm a board certified physician anesthesiologist who completed his training at Johns Hopkins. I also have a master's degree in physiology and biophysics from Georgetown University. So during my time in training, we do dedicate a portion of our time to acute and chronic pain management. So that's really what got me involved with CBD. All right, so we had a quick session about 2 weeks ago. Today we're going to try and also do another quick session. Today's topic is about sublingual administration of CBD. So one of our first questions is, how does it work? So sublingual CBD will work similar to other forms of administration. However, the absorption is quite better, and you basically will just administer a dropper full or so of CBD under your tongue, hold it there for about 30 or 60 seconds or so. Your absorption is much quicker as there are a large amount of blood vessels underneath the tongue, and also your bioavailability is quite improved compared to other ways of administering CBD. Bioavailability is just a fancy way of saying how much of the CBD actually makes it into your bloodstream to be effective for you. So the reason that sublingual is advantageous is that compared to gummies, which the CBD is contained within the candy, if you will, it has to be extracted out of that by your body, and it also has to go through the liver. So the liver will break down and metabolize some of that CBD, so the effectiveness and the amount of CBD that will enter your bloodstream for your benefit won't be quite as good as sublingual administration. So jumping into the actual percentages of what are the bioavailability of the different administrations. So typically for sublingual, a common answer will be about 20% of what is placed under your tongue will actually enter your bloodstream. So say you take 10 milligrams of CBD and place it under your tongue, about 2 milligrams of that will be absorbed. There is some information out there saying that 35% is absorbed, but on the safe side, you can assume that at least 20% will be a normal amount that will be absorbed. So the other routes, some that are actually touted to have higher absorption rates, but slightly less pleasant experience would be the best way to say it, is intranasal administration of CBD. Some people don't like things going in their nose, so it might not be as pleasant as just placing the oil under your tongue there. However, intranasal does have quite a good bioavailability. Some say between 35 and 45%. The oral capsules that people might ingest, they range between 10 and 20%. Edible gummies are close to what oral capsules are. However, some literature does say that they can be as low as 6%. So the gummies are something that aren't quite as effective as the other forms of administration. Now, one area that's been under controversy, at least for tobacco products, was vaping, or at least inhalational forms of tobacco products or nicotine. So that's something that people looked at for CBD. There's not a lot of information on the safety of vaping and CBD right now. However, I would probably recommend on trying the other administrative routes first. The bioavailability with vaping is quite high, pretty similar to intranasal at 35 to 45%. However, we don't have enough information on whether the CBD might be harmful to your lungs, or even the vaporizer or the propellants in the vaporizer might be harmful to your lungs. So we do know that vaping's not recommended in terms of tobacco or nicotine replacement, as the vaporizing process can damage your lungs. So you really should try and avoid vaping at this time until there's much more information about the safety of this form of administration. So one other common question regarding sublingual versus other administrations, is sublingual onset of action faster than capsule oral administration? And the answer is yes. So your peak blood levels from sublingual administration for CBD will peak at about 10 to 15 minutes, as compared to 30 or more for oral capsule administration. Kind of what we talked about the last time, as well as what I mentioned earlier. It just takes some time for it to go through your GI system, get processed by the liver, make it into the bloodstream from the oral capsule, as opposed to the sublingual, which essentially enters your bloodstream rather quickly, and as we just said, the peak blood levels will be about 10 to 15 minutes later. One other common area for CBD is in regards to absorption through the skin. So you're going to get far less systemic absorption, meaning what goes to the whole body. Topical is likely more beneficial for localized regions, issues with the skin, or maybe some muscle inflammation underneath, possibly joint pain. At this time, it's still hard to say. There's not a ton of high quality information or data out there, but there are a lot of consumers who take it, and it does work for them in terms of joint pain and muscle aches and things like that. So it's definitely something that you could give a try to. However, if you're looking for it to improve mood or any of the other things, help with sleep, some of the more systemic things that you'll see by taking CBD sublingually or orally, you're likely not going to see with topical administration, but that's not to say that topical can't work for you. The theory is that topical CBD will actually bind to the CBD receptors in some of your sweat glands and pores in the skin. And that's how it will actually work locally. And that very little of it will actually work its way through the skin into the bloodstream. So that's why it seems to be that your topical CBD will work locally in one spot and not throughout the whole body. Back to sublingual administration, other common drugs or other drugs that are commonly given sublingually in medicine. One thing comes to mind is Zofran. This is something that we give in anesthesia for patients who wake up in the recovery area and have some nausea, particularly those who might be getting ready to go home and have had their IV removed. There's a sublingual form of it that will actually dissolve under their tongue. Cancer patients will take this to help with their chemotherapy nausea as well. Another medication, loratadine, that's Claritin. It's an allergy medicine. Sublingual tablet can go underneath your tongue and dissolve. Nitroglycerin, it's a vasodilator that's used for patients experiencing chest pain or even heart attack. That goes under the tongue as well. And one other thing that comes to mind is when somebody's having a heart attack, crushed aspirin is recommended, and it can be quickly absorbed under your tongue so that it can get to work quickly for you. So as we were kind of mentioning that there's growing data in these areas and in terms of CBD, and we continue to monitor clinical trials, ongoing research with CBD so that we can provide the consumer with adequate information and accurate information. Right now, there's a lot of information regarding CBD in terms of animal models and anecdotal evidence, meaning what people have reported as effects. There are ongoing clinical trials now looking at many conditions that CBD will hopefully be beneficial for, but at this time we don't have the results of that data yet. And as we get higher quality information, this will allow the medical community to become more supportive of CBD. So we will continue to pass along as much information as we can, and we actually, here at Spero CBD, support this research and as well as regulation of the CBD industry. We stand behind high quality CBD products, particularly the ones that we sell here at Spero CBD, and we just want we want consumers to get the products that they're actually purchasing, something that will be effective for them without any solvents, pesticides, or even THC will be found in some CBD products. So we really wanted to offer the consumer a premium product, and that will wrap up most of what we will be discussing for today. I see a lot of people have logged in, and I appreciate your support. I see people waving, so I'll send out a wave back to everybody. Trying to scroll through to see if we have any questions on here. I don't see any questions right now, but I do want to thank everybody for joining us today, and feel free to head over to sperocbd.com. There is a ton of educational content there for you, so if you're looking to learn more about CBD or looking for premium CBD products, go ahead and check out the website. Thank you for joining us today. Feel free to check back in with us in about 2 weeks. Our topic next time will be, can you get addicted to CBD? So we'll dive into that a little more next time. I thank you for joining me today, and stay healthy. Thank you.